Good morning, everyone. Welcome to MEREDA's morning menu virtual event. My name is Gary Vogel. I'm an attorney at Drummond Woodsum and the immediate past president of MEREDA. Thank you for joining us for an update to Maine Medical Center, managing an expansion during COVID-19. So first of all, I want to thank everybody for joining us on this first decent sized snowstorm that we're getting. Obviously, this is kind of an indication that doing these virtually means that none of us had to, shovel out our cars, work our way through the snow and go to a Holiday Inn or some other venue to do this. We're able to do this all from the comfort of our own homes. And so thank you for joining us. And so I want to first mention that in the spring of 2018, MEREDA then welcomed Executive Vice President and COO of Maine Medical Center, Jeff Sanders, to speak to MEREDA members about Maine's largest hospital project ever. Its purpose was to expand and modernize the hospital and to provide the best patient care. 2 years later, in the middle of a global pandemic, we revisit Maine Med for an update on their historic expansion while also managing COVID-19 patients, medical personnel, and construction workers. So during today's program, we will have approximately 10 minutes at the end of the program to ask questions. You'll be able to submit questions through the chat feature. So feel free to do that. Please feel free to submit them during the program, and I will keep track of them. If it makes sense, we can add on or interrupt the speakers. But if not, we'll certainly we should have time to get to them at the end. Before we get started, I do want to take a few minutes to address a few housekeeping items. First, I'd like to thank MEREDA's Morning Menu Breakfast Series sponsor, Norway Savings Bank, for sponsoring our Morning Menu Breakfast Series and for their continued support. 2021 will be the 16th year in which Norway Savings Bank has been our morning menu sponsor. I'd also like to thank our co-sponsor, my firm, Drummond Woodsum. It's only through the support of our sponsors that we're able to host timely and informative events like this one. I do want to take a minute to talk a little bit about MEREDA's legislative initiatives. While much has changed in the past few months, MEREDA's Public Policy Committee has continued to stay engaged, addressing critical matters to the importance of our members. MEREDA was happy to be asked by Maine's Climate Council Working Group on Buildings, Infrastructure, and Housing to provide feedback on the group's recent report to the council, which included suggestions for tackling greenhouse gas emissions in buildings and in the housing sector. This was a great opportunity for MEREDA to share its thoughts and provide feedback before any legislative or regulatory action is taken. Additionally, MEREDA joined forces with the Southern Maine Landlords Association, the Greater Portland Board of Realtors, the Association of General Contractors, and others to form Building a Better Portland, in opposition to the campaign to fight questions C, D, and E on the Portland ballot. And while we didn't get the outcome we were looking for, we were proud to be a part of a well-fought campaign against the 3 ballot questions. We're not giving up, and we'll continue to work with allies and coalition members to try to address these issues going forward. And we are, that work is ongoing really every day with the city of Portland and others. I do want to make a plug for some of our upcoming events. Please mark your calendars for our upcoming annual forecast conference on January 21st. So this year, as you know, we're doing the forecast conference virtually. And typically, this is a live event that is attended by about 1,000 real estate professionals throughout the state of Maine at the Holiday Inn by the Bay. But this year, obviously, we're not able to hold an event with a huge number of people. So we're doing this virtually. We're doing it all on one day like we normally do. And I want to encourage people to, sign up and attend that event Plan on treating it just like you normally would for the forecast conference, and attend all day, listen to all of the different forecasts from the different speakers. We're going to have an economist. We're going to have the sector reports on hospitality, which should be incredibly interesting this year. We're going to have sector reports on office, retail, the normal things, except that this year obviously is different. Not only are we attending virtually, but we're also going to hear about the huge impact the pandemic has had on all these different sectors of real estate. So this is going to be a fascinating event. And I would just encourage everybody to block off your day and attend. We're going to make it lively and interesting. And I think it will be surely, just like every other year, a not to be missed event. So registration information, I think, was just sent out. In the meantime, mark your calendars now to attend one of Maine's premier conferences. And we also invite you to showcase your business as a sponsor and or participant in our truly one-of-a-kind virtual trade show. So check out our exciting sponsorship and exhibitorship opportunities by visiting MEREDA.org or contacting Shelley Clark at the MEREDA office. So I also want to take this time to thank our Cornerstone and Sustainer level members. At every MEREDA event, we are pleased to give special recognition to those members who supported us at the Cornerstone and Sustainer levels. So many thanks to our Cornerstone members, which are TD Bank, the Bullis Company, and JB Brown & Sons. And to our Sustainer level members, AAA Energy Service Company, Androscoggin Bank, Baker Newman Noyes, Bangor Savings Bank, Bank of New Hampshire, Bar Harbor Bank and Trust, Berry Dunn, Camden National Bank, Seaport Credit Union, Drummond Woodsum, East Brown Cow, Eaton Peabody, Epstein Commercial Real Estate, Gorham Savings Bank, Machias Savings Bank, Malone Commercial Brokers, Mascoma Bank, NBT Bank, Norway Savings Bank, People's United Bank, Pierce Atwood, Saco Biddeford Savings, and St. Germain. So we really want to thank all of our sponsors and all of our members for continuing to support MEREDA through this challenging year. A MEREDA membership is a valuable investment in business development, education, and advocacy. If you're currently a MEREDA member, we want to thank you for your continued support, especially during this challenging year. If you have not yet joined, we invite you to learn more. Please contact Shelley Clark, our Vice President of Operations at the MEREDA office. So now I'd like to welcome our panelists, all from Maine Medical Center. So we have joining us Jeff Sanders, who's now the president of Maine Medical Center. He was the vice president at the time he did the 2018 presentation, and Dominic Gagnon, vice president of facilities. Welcome, and I know you all had a busy morning. Jeff, thank you for jumping in and joining us. And I'm going to turn this over to Jeff and Dominic.
Thanks, Gary. Thanks for having us. We're excited to be with you, and in the holiday season, happy holidays to everybody as well. What we wanted to do this morning was just give you a brief overview of the history of our campus here in Portland. Explain kind of the perspective of the project that we have underway. Show you where we are with the project. We have several videos we want to share, which I'm a strong believer that stories help tell the reason why much better than a PowerPoint. So we have some videos we want to share with you as well. Then I'll transition to Dominic, who joined us about a year ago. He's been with us for several years, helping oversee all the projects we have underway, to talk about the impact the pandemic has had on maintaining the construction project on schedule, which we have been able to do, but it hasn't been without a lot of flexibility by our partners in the construction industry. So Dominic will illustrate some of that. But I want to start first with an image of our campus here on the Bram Hall Hill that illustrates the history of Maine Medical Center. And I'm from Maine originally, and was a history major in college. So I like to start with the first building right in the middle. So we started on this campus in the early 1870s. It was a law that was signed by then Governor Joshua Chamberlain, who holds an important place in our local history. that created the Maine General Hospital, which became Maine Medical Center in 1954. So we had a fairly significant presence on the Bramhall Hill up to 1960. And you can see those buildings illustrated in gray. And we continued to grow with what is the Richards Tower in blue there, which is still a significant portion of where we care for medical surgical patients on this campus. And they continue to branch out with our most recent addition being adding ORs in 2015. So as we looked at what we needed to do on this campus to support patient care, we looked very carefully at the engineering infrastructure of this building and the ability to actually effectively and safely care for patients. I want to share kind of what we initially thought we were going to do on this campus as we started working with the city of Portland. It's what we call our butterball slide from 2016. And really what we looked at on this campus was, what do we need to do to support the acute phase of illness for patients who come to Maine Medical Center? And we needed to do a few things. One, we needed to create more private rooms. It becomes very important, particularly as you're managing patients with viruses. This would be an extreme example of what we're living through right now. We also needed to update our operating rooms and our cath labs. We needed to provide better parking for visitors to our campus, since we also needed to replace a parking garage that was approaching 50 years and beyond its useful life. So those were the components that we really wanted to address as we went through the work with the state through a certificate of need process, as we worked with the city of Portland to update at the time what was a contract zone. And when we met last time, I shared with you the work we had done with the city to create an institutional overlay zone for Maine Medical Center that gives us predictability to support the phase of the project we're doing now. Also importantly, gives the community predictability about where Maine Medical Center may expand into the future. I want to give you an update on where we are with the project. We've made significant progress on the project to date. So the components you can see here, the one we just showed with the video, I'll start from the top left and rotate around clockwise. The Cologne family tower is 64 private rooms. You can see on the top, there's a DEC. It's one of our 2 helipads that we placed up there that creates incredible vertical transport for patients coming in by air ambulance to Maine Medical Center. It actually saves 2.5 minutes of time, which is important time for patients coming here for care by air ambulance. I'll mention here briefly, and Dominic will touch on it, without those 2 new floors that came online, as you saw in the previous video in early January, we would not have had the flexibility on this campus to care for the level of virus that we've seen, as we've created separate spaces for patients coming in with the virus and then maintaining separation for patients who don't have the virus. Going over to the right, you can see the medical office building in Scarborough, which is 108,000 square feet, will be completed late this next spring. Provides capacity for our neuroscience program, our vascular surgery program, and ear, nose, and throat. Each of those programs, work here in Portland, but really provide access to care for patients from throughout our entire region. Down to the right below that is our new parking garage, which opened up earlier this winter, which replaces the garage on Congress Street, making way for a Congress Street tower. It consolidates all of our parking in Portland, 2450 spaces, provides very predictable parking for our staff, and really cleans it up, I think, for our community as well. And the last photo here, right next to that, is the last piece of this project, and it's the Congress Street Tower, which we've started. With the garages come down, and that piece of the project will be completed in probably the middle of 2013. Provide a good entrance from that part of our campus, and provide really state-of-the-art facilities for a cardiovascular team, which provides world-class care for our community. I believe there's a video that we want to show now, which will go back to the earlier part of my story and really explains the why we entered into what is a $550 million project for Maine Medical Center and our community. And we can run that video.
Today is a very big day for us, with a total population of patients approaching 549. This is a busy day for us across all parts of our hospital. Everything is at its max.
Maine Medical Center has really evolved into being the tertiary care hospital of the entire state. As that happens, the most difficult cases come to Maine Medical Center.
The trend is our patients are getting sicker, and we don't have the facility space to accommodate that.
We are working harder than ever to do what we need to do to take care of the patients, and we do take care of the patients optimally. It's just this stress on our staff and on our facilities will continue to grow.
Let's go.
Maine Medical Center has made a commitment to be patient-centered. And one of the essentials of being patient-centered are the facilities that you operate in. We're very excited to be moving on to the next phase of facility planning at Maine Medical Center to live up to that commitment.
These operating rooms were built 30 years ago, but a lot has changed. We've got all kinds of surgical equipments and instruments that are required here.
I would describe it as a very tight obstacle course.
Here's a lot of the equipment that we're currently using in surgery that has no place to be stored. We have to store it in the hallways. 21st century technology is really helping us take really great care of patients. But what's interesting is our facility hasn't changed, and the time has come for it to change.
We're on an adult medical surgical unit called R2, mostly double occupancy rooms. There are unique challenges caring for 2 sick patients in one room.
You can see how congested the foot of the bed is. Just getting somebody on a stretcher or wheelchair means you have to move all the furniture in and out. It affects everybody that's going in when the room is barely enough room that you can move around.
But sometimes patients are too sick to share a room. Every day we have upwards of 50 beds that can't be used because of patient condition. The bed availability every day is low, and the impact of that is significant on patients who want to come here from the ED, from the OR, from other hospitals, from the doctor's offices.
We opened a new emergency department in 2009, yet our biggest constraint right now is being able to take patients that need to further care in the hospital and move them into the inpatient beds. They often have to bed, or what we call board, down here. That means we have one less bed to move an emergency patient through, and we then start to move into hall beds.
We have become busy enough that there are always patients waiting for that bed. We want the best care for every patient, every time.
In the mother-baby area, we opened that in 2008. It's really worked very well for patients and families where they have privacy, they can sleep, they can have left alone time. It's phenomenal.
What a difference when we look at our Bean 2 facilities here that was opened in 2015. The rooms are very spacious. We have adequate storage areas for all of our cases.
The staff love the new operating room space. It's a whole different world.
What really gets us excited is providing the best possible patient care we can. And it's exciting that we're entering into this next phase, which is going to include additional beds that are desperately needed here at Maine Medical Center, a new parking garage. We're going to be building a new platform here for inpatient and operative suites. This is just part of our original dream that we had going back some 15 years ago.
This is really what we're looking for at Maine Medical Center so that we can continue to deliver the expert care that we've been used to giving, and we continue to do that for many years to come.
So, you know, as I said at the outset, I like to tell stories. And I think as we started to work with our community, you know, internal stakeholders, but more importantly, the state and the community, it's really important to explain why are you needing to invest? What is $500 million, which is a lot of money for our community. And the story is very strong. You know, our care teams work incredibly hard here. We need to provide a better platform, a more modern platform, and we're doing that. And I couldn't be more appreciative of where we are, the work that our team's done during a very challenging time, but as importantly, the work that our partners have done in the construction industry to keep the project on schedule, safely take care of their team so that they can go home to their families and keep this work on progress. I'm going to turn to Dominic to talk about some of the work we've been doing during this period with our teams to make sure that they have what they need and to make sure we do keep the project moving forward on schedule in a safe way.
Great. Thank you, Jeff. And thank you, Gary, for the introduction and the invitation to speak today. We reached a point here where COVID all of a sudden arrived. We had this master facilities project moving along for several years. This has been a long-term effort for Maine Med in terms of planning and getting through design and permitting and so forth. And here we are, excited about the Cooloom Tower opening with the 2 new floors of 64 beds and the helipads. Really on a roll with the St. John Garage as well. The new parking structure was completed at the end of 2019 as well, opening up in January of this year. All of this, as he mentioned, was incredibly fortunate in terms of serving us during this pandemic. Without that garage, without the additional capacity that provided, without the additional capacity of beds, without the helipads, which going from a single helipad to 2 helipads has had a tremendous impact. There are days that you will find 2 helicopters on those pads. And prior to that, they would have to drop one off. They'd have to take one, bring it over to the jet port, either do an ambulance transport, or it's one that already dropped off a patient and they're just waiting at the jet port, then they would come back. So it created additional flights into the campus as well. So the timing of this was pretty amazing in that, somebody was looking out for us. With that said, we started to hear rumors of the pandemic out in China and approached our construction managers and started talking about, what are we going to do and how are we going to plan for this and so forth. And there is crisis management plans within their contracts and within their subcontracts with their team. And it was a matter of reviving those, refreshing the team on what some of those measures are for certain situations without really knowing. And this is early February, middle February, when we're just started getting out there that we started doing some planning on this. At the end of February, our CMs in a proactive manner, and part of this is because we had folks from all over the Northeast working on this job based on the complexity and the scale. Even though there is a primary commitment and the overwhelming percentage is Maine labor, we did have folks traveling up from Mass, Connecticut, New York, New Hampshire, Vermont, and they were having different impacts and different executive orders from those governors, which created a little bit of a challenge here. So, while jobs in Boston and Cambridge, for example, got completely shut down and overnight, they had a week's notice to make the job safe and get everybody out of there. We did not face that yet in Maine. We did not have the same level of exposure and incidents up here as they did in Massachusetts. Massachusetts was a pretty high state in the beginning. Actually, we have a graph on this that just kind of historically puts it in perspective here from March into the second wave that we're in now. That shows up on the bottom right-hand corner of this slide. So, while we had that blip early on, it is really this second wave here that we're in now, where things are starting to become a little more complex again with the winter coming. The reason this was not an issue early on, or as much of an issue, is these projects were considered essential. The goal of this project, as Jeff mentioned, is at least the phase that we're in now, is the Congress Tower, which will ultimately hold 19 procedure rooms, another 64 up to 96 new beds, primarily ICU beds. And when you think of what the pandemic was like early on, and we're still seeing incidents of ICU cases, this is a critical project for this community, for the state of Maine, the region. And the decision was made by the governor to support the healthcare projects. So with this said, we had to look at short-term impacts and long-term impacts. How do we deal with this? Short-term impacts, the things that came to mind were with the executive orders, there were travel restrictions and other things that had to be managed. So again, we had workers coming up from other states that we had some incidents where they would be pulled over on the side of the highway, and it was, validated that they were here for essential work, as the out-of-state plates were being looked at carefully to make sure that there was no non-essential travel. With that said, the PPE discussion, as we all know, the beginning of the pandemic had an incredible challenge with PPE. And what happened on the construction side is when the manufacturers made a shift to increase the surgical masks and so forth, we lost the filters for respirators on the construction side. So there was a little bit of a blip there in the supply chain of PPE because the focus got diverted to a more important cause at that time. And that was something that, in hindsight, I think the contractors have learned that they will likely keep a larger supply of filters for things like respirators and so forth that are critical for them to do their jobs. Getting a handle on that, we have a full-time nurse on site for the projects due to the scale of the job to help with the safety of all the employees. And that could be anything from the morning huddle start with a stretch and flex, trying to minimize the miscellaneous twists and sprains and things from just not properly stretching and getting ready for the job. Having this nurse on site was a tremendous benefit through this. They were able to help guide the team a little bit further. They actually brought in a sewing machine. The nurse brought in a sewing machine and started making masks for the guys early on when they could not get masks. So it's been a tremendous team effort with the partnership with Concentra, who provided that nurse. With that said, the PPE obviously leads right into the labor concern. So, what happens if a worker gets tested positive? Were they carpooling with somebody? Did they come in as a crew in a van with 8 guys? Were they traveling from out of state? Are they staying at a hotel? Where are they eating at night? So forth, and all the contact tracing that comes with it. Knock on wood, in the first wave, we did not have any incidents on either of our jobs. And that was at a time of about a total of 100 workers on site, roughly 30 or 40 on the Congress Street project, and about 50 to 60 in Scarborough on the medical office building. The fortunate part of both jobs was that we were at a stage where most of the work was outside. We did not have confined spaces. We did not have large crews working in close proximity in the first wave of the pandemic. That had a tremendous benefit for us, obviously, as we've learned. We've learned more and more as the pandemic has gone along, and the masking, distancing, and sanitization has obviously been the 3 primary factors. And we naturally had some protection built into these projects with the phases we were at. To this point, to give you an example, the Gilman garage, the garage that has stood there for 50 years, that reached end of useful life, was in getting ready for demo this summer. And ultimately, that just consisted of a couple of workers in some rigs that were doing some high reach, precise demolition with a small claw and some water jets. Very few workers on site at that time. And we do have a short time-lapse video of that we can tee up here for your benefit. It's always interesting to see a building a road away. We wish it went that fast in real time, but it's that was about a 2.5 month process, which was ahead of schedule. It actually went incredibly smooth. Very little dust, very little vibration or disruption to neighbors or the hospital. Keep in mind, the Bean building right behind there has ICUs and operating rooms just adjacent this site. with a number of tiebacks being drilled into the hill and the garage coming down. So an incredible effort by the contractors to be able to do this with all the challenges of the pandemic, to do this safely with no incidents, is just absolutely remarkable. In Scarborough, we had finished site work. We had done blasting and so forth, and foundations were underway, and we were starting to erect steel. The one hiccup we had, so other short-term impacts, so we talked about the labor briefly. Supply chain was the other one. So there were a lot of fears early on, what will the pandemic do to the construction industry? Are we going to have an issue with materials, in addition to the labor concerns that we had? And with that, you started getting letters, especially with Boston and Cambridge shutting down and the construction industry as a whole not knowing where this was going. Force majeure letters came out, and people are trying to protect themselves however they can, not knowing what the world was going to bring. Unfortunately, none of these fears have really developed. It is something that the nature of the jobs, again, had some protection into it. And things such as productivity loss due to wearing a mask did not come into play. While additional water breaks had to be provided in the heat, and we had to let the crews stop a little bit more and make sure that people were safe working with a hard hat, eye protection, masks, so forth, because it does change your breathing habits a little bit and so forth, did not really pan out. People have gotten used to it. It has become the new way of life for all of us, as we know. Very challenging in the beginning, but for those of us working in environments where you have to wear a mask on a regular basis, it's just kind of become a way of life. And that's how it's translated in the construction industry. So supply chain fears, with steel going on in Scarborough, we did have a week delay from Canada. They had shut down everything in Canada, and Quebec had closed the steel plant that we were working with. Within a week or so, there were enough pleas from the steel industry in Canada, which provides most of the steel here in the Northeast, at least the raw product, that this was essential work and projects needed to continue. So we were able to get steel, with a delay of about 7 days, and they have since caught up and are back on track. In terms of long-term impacts, what does this do to the industry when you start thinking of labor and supply chain and so forth? And there are definitely some lessons learned on this. So with supply chain, the lessons learned that we've been focusing on have to do with resiliency built into the supply chain. Not only did it have to do with the initial stock of PPE and other materials that may be an issue, it had to do with whether or not the suppliers of certain materials had resiliency built into their manufacturing process or delivery process. So for example, one company a global company that everyone uses, may be relying on one manufactured component or assembly plant in one country. It might be in Asia, it might be in Indonesia, it might be in the United States. But if they're relying on that one manufacturer or one facility, and that labor force is impacted, or there is a regulatory delay caused, we have a problem in the supply chain from something we didn't anticipate. So the companies started looking proactively, the contractors started looking proactively at our requests that, where do we find resiliency in the supply chain? Can we pick vendors moving forward that have 2 and 3 options for manufacturing facilities? Do they have different means of delivery? Do they have additional sources that they can draw on to provide us the product for our job? That has become how we've approached these jobs. And we've actually made selections on certain subcontractors based on this resiliency built into the project. It is something that we're glad we have done, and especially with the second wave hitting, and we're obviously seeing record numbers of cases and hospitalizations now. It has played in, because even with some of the hits we've taken, knock on wood, we have still not seen any impact to our supply chain on these jobs of any order of magnitude that is a concern right now. We are still on track with these projects financially and from a schedule perspective. But it did take some planning. Another part of the long-term lessons on this is we intentionally are, I come from a background, an extremely large advocate of working in a lean manner. In construction, it's had tremendous benefits. to focus on lean practices in terms of, anything from tools like pull planning to job site, job boxes on wheels and the cleanliness of the job site and just-in-time deliveries. And there are many facets to what lean means in construction. But the biggest advantage that is played out here is with lean comes a larger percentage of pre-manufactured work or modular work. That has been a tremendous benefit for us. So we have had a number of, especially on the Scarborough Medical Office building, the exterior skin on that building is panelized. And so the panels are coming in, they already have these studs, they already have insulation, they already have vapor barrier on them. They are ready for the windows to be popped on, and the building is weather tight. So what ends up happening is rather than building this on site with a number of crews and a longer schedule, they could build it in a very controlled factory, which from a lean perspective is advantageous from a schedule and a quality standpoint. But from a COVID and a pandemic standpoint, what we have learned and what we have gained on this is that those people are protected in that environment, and you can control that environment for them in a safe manner. At the same time, with the fewer people on site, our exposures on site were incredibly limited. So electrical is another example where rather than having them pull every wire on site and do every termination and every connection and measure everything out on site, which traditionally is what the electrical world has done, we ended up sourcing a subcontractor who has basically kitted, KITTED, everything for the job. So they have a plastic bin labeled with this exam room in particular. They open up that bin, it has instructions in there for the one installer that's in that room. All the wires are pre-cut, pre-terminated, proper length. It tells them where to run it, where the outlets go. The outlets are already in the boxes. It's going incredibly fast with one person in the room and without material draped all over the site that people can trip on or people are working around and causing other problems. So again, we cut the workforce on site down dramatically and did not eliminate the workforce by any means. They're just residing in a larger manufacturing space that allows for proper distancing and other controls to be put into place. So again, the pre-manufacturing and the modular nature have been a tremendous asset, along with the resiliency in the supply chain. With that said, we are at a point now where the Scarborough Medical Office building is weather tight and 33,000 square feet per floor on the 3 upper floors that are primary clinical space. It is busy. They are under a policy on both jobs of 100% masking all the time with proper distancing and so forth. We've had to break up the breaks and lunch schedules and limit the number of folks that can be in there. And that's not mandated by Maine Med. That is something the contractors got way out ahead of and implemented these in advance. They created a one-way flow in the building. So we have a stair tower to go up in the building, a stair tower to go down in the building, and have done things like you've seen at your local retail and grocery stores and so forth with arrows on the floor and other measures to try and help with this. Sanitization efforts have been increased. So we've had a slight, nominal increase in cleaning costs, making sure that we have additional hand washing stations, making sure that we have cleaners coming in, dealing with high touch surfaces. They are screening all contractors, as you would expect, on both jobs. We have now migrated a little bit more to a self-screening process, not unlike what we do here at Maine Medical with an electronic device, where you certify that you do not meet certain criteria, and you confirm that each day as you come on site. And that's limiting the amount of contact we had originally. When the pandemic first hit, they were physically having somebody go and take their temperature and kind of greeting everybody and signing them in and so forth. That's now kind of by the wayside, and we're trying to minimize that distancing, or trying to maximize the distancing by minimizing the contact. So with that said, we've survived this incredibly well with a bit of planning and effort to minimize the impact here. Our number one goal, and this has been expressed to both contractors managing the projects, and is to do this safely. The goal is for every contractor in and out of a pandemic to go home safely to their family. That is 100% the priority on these jobs. There is nobody that should ever feel like they're doing work that is unsafe. There is nobody that should feel pressured by a schedule. There is nobody that should ever feel like they need to do it at the risk of them or their family. And knock on wood, it's been a great process so far. The contractors have been incredibly cooperative and had their own desire to stay safe through this pandemic. So with that, I know we're getting close to time here, and we want to turn it over to Q&A, I believe. I don't know if you have anything to add to this, Jeff, but.
Yeah, just one closing comment, Gary. Thanks, Dominic, for going through that. Thanks for having us again, Gary, and to the work that you and your group do. It's been a remarkable time for all of us. You know, we could spend time talking about the great work we're proud of that our care team has provided during this period of time. And I think as a community, we've generally done a very good job, and we got to stick with it. You know, we have vaccines that are out now that show incredible effectiveness. You know, I think the goal we all have as a community is to make sure the supply chain of that is strong, and we get those out to those who want them as quickly as possible. But again, Gary, thanks for having us, and look forward to the conversation that follows.
Great. Thank you both. Really a fascinating project. So, you know, I think we have the opportunity to, you know, talk a little bit about, you know, sort of the kind of lessons learned and the things that you're doing in terms of construction in the pandemic. But I think we also have a little bit of time to talk about sort of operationally and the, you know, the impact upon real estate and you know, the in the whole delivery of medical services. So hoping we can get to, you know, all of those things. I'm first going to turn to a question that we got on the chat from one of the viewers, and that has to do with probably your overlay zone and the planning that you've done for the neighborhood. And this is, do you foresee expanding on the site of the large surface parking lot between Chadwick, Vaughan, and Brackett Streets? Are there restrictions on the ability, you know, to build there? I know you've looked at the whole neighborhood, and you've developed a kind of, you know, master plan for, you know, what it may include future expansion. So maybe you can talk about that generally and this space in particular.
Yeah, no, happy to. It's a good question. So I'm going to go back 5 years, probably, maybe 5.5 years. We started working with the city of Portland around an amendment to our contract zone at the time. And to the credit of the city, and Tuck O'Brien in particular, who was in the planning role, you know, he proposed that we not look at an amendment to the contract zone, but that we think about, you know, instituting in the city of Portland an overlay zone concept, which, you know, we had to work through the city council to put a new component to the zoning code to accommodate that. And so as we did that, of course, you know, we needed to propose back to the city, the planning board, and the community here. And we work with 5 neighborhood associations on a regular basis on what we thought the footprint of that overlay zone should be to support future development in Maine Medical Center. And so as we did that, we did include that surface parking lot that the individual asked about. And with that, as most of you know zoning a lot better than I do, what came with that is what are the permitted uses, and what are the height restrictions, what are the setbacks, what are the transition zones. And so we know within the footprint of the overlay zone, which includes that surface parking lot, goes down Congress Street to St. John Street, turns the corner for about a half a block. Also includes across the street where when I was a kid, the Sportsman Grill was. Now we have great salvage barbecue. So we know within the overlay zone what the permitted uses are and what the density is that we could build. And so, for example, not to go through all the permitted uses because I don't have them right in front of me, but that surface parking lot obviously could maintain its current use, which we plan to do for some period of time. No future plans right now for it. We could build a medical office building there. There are some requirements about what retail would look like surrounding the outer edges of that, not surprisingly. And we could use it for administrative services too. So I think in the future, whether that's 10 years from now or well beyond, you know, I think future development on that site would be consistent with services we provide here at Maine Medical Center and would be in the outpatient ambulatory part of the care we provide.
Great. Thanks. Yeah, I know that I remember going back to the program you presented in 2018. We talked a lot about that overall, overlay zone and the work with the city and the neighborhood associations, and I think really a model for what you folks have done for that sort of large scale campus development in in Portland and in our state. So
let me add a
Dominic,
comment.
yeah, go ahead, Jeff.
If I can, Gary, just a comment about that. Maybe we talked about this in 18. I can't remember the sequencing of all the decisions we made. But one of the things the overlay zone allowed us to do was think differently about how we would accommodate parking on this campus. And we have, for employees and physicians who aren't employed who work on this campus, we have the need for up to 2,000 parking spaces a day. That's a lot. And we had those scattered around the city of Portland, including that old parking garage that we showed the time-lapse video of it being deconstructed. That allowed us to think about where we would conveniently site a very significant parking garage, meeting our needs today and hopefully for the next 10 years, close to campus. Without the overlay zone, we wouldn't have been able to have that conversation. We would have been shoehorning it into the Gilman block, which wasn't really the right location for the neighborhood and really wouldn't have met our needs in the near future.
Yeah, really a fascinating process. So I'm going to turn to Dominic. Dominic, you were talking really about the supply chain issues and the sourcing from, making sure your vendors had options and things like that. And you also indicated that that you've been able to stay both on track financially and with respect to the schedule. But I've got to believe that there has to be some increased costs from turning from one, with your contractors and subcontractors turning from one vendor to another. There must be, preferred vendors who are, have lower costs for the same goods. Can you describe, the sort of process of, making sure that you've got that capability and redundancy, but how that, may have an impact upon the budget?
Yeah, there is not. The items that we were still in a procurement stage of were the ones we were able to influence, as opposed to changing something that had already been procured. So that's one significant component. So we did not go back and change anything that had already been contracted. With that said, moving forward, through the procurement stage, there was a lot of back and forth dialogue with the subcontractors. And you'd be shocked at how many, when asked the question of whether or not this type of resiliency could be built into their plan, did not affect their initial bids. It was a matter of, okay, yeah, we could use either one of these drywall companies, but this one happens to suggest that they've got, materials coming from these 3 locations, of which are geographically spread across multiple states or regions. It gives us a little bit more resiliency than one that's pulling from 2 suppliers that are in the same state or in the same region. So it was those kind of nuances to those discussions that allowed us to do that. We were incredibly fortunate. I don't want to state the exact subtrade because it's very limited to who would be involved in that. But one of them was an extremely significant contract, and it just so happened that the most qualified and low number happened to be one that had 3 options on the manufacturing of that product, compared to their competitor, which was much more commonly used here at Maine Medical in the past, who only had 1 manufacturer, and it was in Asia. So that was one where we were able to make a conscious decision with no cost whatsoever in a 7-figure contract that allowed us to gain the opportunity of having 3 different sources of product within the same bid. So, and it was the low number to start with. Again, being in healthcare, we are incredibly careful not to just look at low bids. That is not the way we work and operate in healthcare construction. Quality and patient care is the #1 priority. And there are times when the low bid does not meet the other criteria that we need to meet. So that is a big part of this. And those discussions do get had, and they get elevated when they need to. So, if there's a significant cost difference and it's not within the proposed budget, we are always going back and having these discussions as a leadership team to make sure that we are making the right decision from a number of criteria perspectives.
And I know that obviously, you mentioned that there haven't been any delays either, but obviously I'm sure you're contractors and subcontractors have had to work really hard to accomplish that. I know, especially during the beginning part of the pandemic and the shutdowns, obviously construction was an essential, industry, but at the same time, I probably looked at more force majeure clauses and in a short period of time than I have in my entire, practice. Looking at that, I know how to spell majeure without having to, double check myself each time now because I've done it so many times, as I'm sure you probably have as well. So, any observations in terms of the, work and the work that the subcontractors and contractors have done in order to maintain that, despite the fact that they obviously have certain tasks that take more time, or that they've had to, implement distancing on, which may have an impact upon the schedule.
Yeah, absolutely. There has, again, I think the stage we were in early on helped us tremendously. When you think of just finalizing foundations and starting to erect steel, it's incredibly low impact work from a pandemic standpoint. Same thing with the demolition of the garage. It's very limited people. Most of them are in individual pieces of equipment. So there really was no impact. They didn't have to be massed within the cab of their own piece of equipment if that's where they were going to be for 8 hours. So we have not seen those issues here. The second part of that is we have been incredibly careful in selecting teams that are truly team-based. You can't have a project heavily focused in lean practices and fighting for common goals without having a bunch of team players. And part of our interview process in bringing everyone in has been, what are they bringing to the table from a team perspective? Are they looking at this as a holistic view, as opposed to just watching out for their company coming in at low dollar and, looking for change orders down the road? That's not the way we've selected and built these teams. And it's based on a lot of referrals. It's based on experience. It's based on quite a bit of work in place prior to that, examples of that work. And we think that has been one of the biggest factors in mitigating some of these risks. But I can't understate enough that we were in an incredibly fortunate phase of construction on both projects. This second wave is a little bit trickier, like I mentioned in Scarborough, but we're working through it. We had already built in a second shift to maintain an aggressive schedule from the start. We had bought the project that way. What that has done is it was not only a second shift purely from a schedule perspective, but we knew we couldn't be doing finished drywall during the day and still have painters working in the same general areas trying to finish paint. By doing it at night, you can get some mud on the wall and somebody can be painting during the day, and at night again, they're putting mud on the wall and so forth. So we had already implemented a second shift on the job and had been carrying some overhead to cover that. And what we found is during the pandemic, a couple of the contractors have just opted to go to second shift work for their own protection at no cost to our project. So again, some built-in factors, and some of this was pre-planned. Again, we knew we were going to have a tight job with a lot of people with a condensed schedule. How do you minimize that? Second shift made sense back in January and February. Little did we know the pandemic would hit and that would work out. Again, same thing with all the modular and prefabricated work. We minimized the number of people on site, and it's no impact to the subcontractors' costs. They were already planning to build it in the shop and just send out a couple of guys with just-in-time deliveries. So there were several models built into the structure of these jobs that have protected us all the way through.
Have you had to utilize testing for any of your vendors, suppliers, contractors in connection with the project? Has that been a part of the overall, safety plan for dealing with building in a pandemic?
They have individual policies. So not only do your construction managers have their safety policies in terms of what they want to see for screening and quarantines and contact tracing and so forth, but the subcontractors all had their own policies as well. And all of the testing individually for the contractors that have gone and gotten tested have done so through their own organization or through their own means within that trade. So there has not been a general program although there has been talk that if we ever got into a bind or if they ever needed our assistance, you know, in working with Concentra and Maine Med and the resources available, we could support those teams if we ever needed to, but that has not been an issue to date.
And sort of one related question is, obviously with such a large project like this, obviously some of your construction workers must be coming from out of state, and maybe not just from Vermont and New Hampshire, which seem to be the only two states now where you can travel freely, you know, in and out of Maine. You know, how has that affected their ability to, you know, to work with that? Obviously, they're essential workers. You know, I haven't followed necessarily whether there are exceptions for them compared to other visitors from, you know, from other states. Any thoughts about that?
Yes, and there are exceptions for that. So one of the challenges early on was the lodging, because as you know, the hospitality industry was decimated early on with hotels being shut and so forth. But we did have a couple of key partners in the area that had offered lodging to essential workers, whether it was nurses and doctors coming from out of the area or contractors supporting the job. As you mentioned, we had a crew from Connecticut for a given activity. We had a crew from Rhode Island, and we have some folks from Massachusetts traveling up as well. And they were all under those same restrictions, Massachusetts being the longest of that bunch. But again, the essential workers were exempt. They were following all of these measures on site when they were here. Most of them were not even allowed to carpool, had to bring up individual cars based on their own subcontractor policies. And then they had their lodging predetermined, you know, same place every week and so forth. Many chose not to go out and buy food at retail establishments. They were trying to really isolate within their hotels and either bring food with them or get groceries as soon as they were in the area. And we provided some sources for delivery for them and so forth to make sure that they had options available if they were not comfortable going out, and we didn't want to increase any exposures.
Great. So we have a few minutes, just a couple of minutes, but I do want to talk a little bit about on the operations side. Obviously, you're transitioning from a construction project to operating all, you know, during the pandemic. Have there been, you know, changes in terms of the way that you foresee delivering, you know, medical services that have, you know, impacted the project in terms of, you know, making any changes in the design or the, you know, the way that the projects are going to operate, that you will incorporate, you know, going forward as part of this?
So far, it is a lesson still being learned. You know, if you think back of everything we knew of the pandemic back in February and March and what we know now, whether it be how it is spread, the rate it is spread at, and how it would impact the industry with, and I'll let Jeff elaborate on this if you'd like after, but telemedicine and other components that have been talked about quite a bit in the media. There is not an immediate change to the construction and the design just yet. It seems as though a lot of this will take some time to play out in terms of complete lessons learned, impacts to the industry, and then what are the regulatory impacts? So from a construction standpoint, while there have been a lot of exceptions made for you know, short-term care sites and alternate measures at the hospital with how we're treating negative air and creating spaces for COVID patients and all that, that is not currently written into the codes that we're regulated and governed by. So there is a lot of discussion on this going on with folks writing these things that, and the design world in general, architects, engineers, and so forth, that there will be a tremendous effort ongoing for the next 2 years to understand what are the impacts, what can we do better, and then do the current codes support it, or do we need to change the current codes and guidelines and regulatory components? Chances are there's going to have to be some efforts on that front before there's a commitment to make any major decisions on construction today. Just to make sure that we're currently operating under a current code, and we're going to continue to operate that way. Understanding that there may be additional telehealth or there may be additional things down the road from an IT perspective and bandwidth and technology and so forth. Those items are being looked at. but it has not had an impact on the built environment just yet.
And similarly, I would say for Jeff, in terms of operationally, obviously we're in the middle of a second, or I don't know whether it's a third wave now, but a lot of medical services are being delivered differently. I mean, do you see? Is it too early to tell, like on the construction side, in terms of the use of facilities? Or, what do you see as lasting changes that we're learning from this in terms of the way that you're going to use space and deliver medical services? I know that's a big question, but whatever comments you wish to make in a brief amount of time we have.
Yeah, no, I think the one area, Gary, is how we use telemedicine for remote care. Prior to the pandemic, obviously we were setting up infrastructure to support it. We were going at it from a very conservative perspective, largely driven by the fact that the federal government, which pays a lot of our healthcare bills, particularly in a state like Maine with an older population, didn't reimburse for it that much. During the pandemic, they've loosened up a lot of those payment policies. We've seen our telemedicine consults at Maine Medical Partners increase to 14%. And so that's, I think, one of the biggest unknowns. What will the federal government do through the Medicare program as we come out of this pandemic? And where is it appropriate to provide remote care? So I think that's probably the biggest change that we're going to see. And I think it's probably a good change for those patients who don't need to travel into a medical practice for a follow-up with a doctor.
Yeah, I mean, especially for a rural state like Maine, telehealth obviously is really a game changer. So anyway, we're really out of time. I know you guys are incredibly busy with everything going on in the medical world and in the construction jobs that you're managing. So I do want to thank you both for participating in this, a really fascinating discussion. Wish you the best with the continued development and completion of those projects. And I can't wait till we can all kind of gather and celebrate their opening at, some type of a ribbon cutting or something like that I'm sure have been, delayed or made virtual. So anyway, thanks again. And to everyone who's participated in this event, have a great day, stay safe. And hopefully this is a good day for people to be working from home and not having to get into their cars and deal with the snow. So thanks again.